a lot of what our work is trying to do is trying to put a different perspective on climate change, trying to draw what a lot of times can be a very technical, scientific discussion into a suite of impacts that people understand. So it's taking projections of, and the current EPA project's using some of the most recent projections of future climate from a series of global climate models. And then trying to link that information, which is really what does the future climate look like in terms of temperature and precipitation, with other lines of evidence from epidemiology and public health. So it's trying to draw those two pools of information together to develop, informed and reasonable projections about what impacts could be in the future, holding a large number of things constant. And that's pretty important too. When you're projecting impacts out to 2050 or 2090, the number of things that we're holding constant is very significant. But again, it's all part of trying to really put a different characterization on the stress that's associated with climate change. There's a lot of arguments that could be made that some of those health impacts won't be realized, that there's things cities or governments could do to avoid those changes. And that's right, they could do those things, and that's, potentially the upside. The problem is they have to do those things. Those would be actions that they weren't planning to otherwise take, and those represent, commitments of resources and time that, in a world of scarcity, there are other competing demands on those same resources.